Podcast where we give you the truth, the whole truth, and nothing but the truth. So help us God, where we take all these complex health and wellness topics, chew them up into little, small, simple, digestible, swallowable segments. And then we give you action steps that you can start taking today to change your life, your family's life, and the life of the people in your community. Hey, I'm your host, Dr. Eric Naputi. We're going to be going down an interesting journey today that so many of you ask me about all the time. You say, Doc, I'm so sick and tired of being inflamed. My joints hurt. My back hurts. My neck hurts. My hip hurts. You know, you're over the age of 30 and you feel like you wake up and got hit by a truck and all you did was sleep at night. Well, how many of you know that a lot of times the reason why you have the chronic inflammation is because of the foods that you're eating and not eating? You're going to be surprised how simple some of the solutions are of fixing some of your chronic pain problems. And if you know people that have to pop Tylenol or ibuprofen or Advil or are on chronic painkillers or muscle relaxers, you need to get them this podcast. But this can and will be a game changer for you and for them. So let's get into this. Did you know that recently, within the last 2 weeks, a huge study came out of the Ohio State University found that nearly, listen to this, 60% of Americans are consuming pro-inflammatory diets. This is a major rise, causing an increase in heart disease, cancer, chronic inflammation, and chronic diseases. Men, by the way, and women, but men and typically individuals of lower incomes are most likely to consume higher inflammatory foods. And I'm going to tell you right now, that's not because of lack of resources. That's because of lack of knowledge. Okay. I'm just telling you, it's cheaper for broccoli than it is for a Twinkie. Okay. It's a lot cheaper to eat clean, healthy foods because you can consume less of those foods and less calories and have a higher return on your investment. We're going to talk about that in just a minute. But listen to this. Inflammation is massively misunderstood. Most people think they have to get rid of inflammation to get rid of their problems. Well, inflammation is important. It's a process of healing. When you cut yourself or when you injure your shoulder, your body, your back, whatever, the first thing that happens is inflammatory markers have to come in and mark the damaged tissue. They literally put little flags on that tissue. Then more pro-inflammatory chemicals come in. They digest the bad tissues. They break it down and they take all the waste and then they put it in the lymph system so it then can be taken out of our body through our sweat, our breath, our bowels, or our urine. The problem is the chronic inflammation. And the chronic inflammation people have is because of deficiencies of certain nutrients and toxicities of others. I'm telling you, the problem that most of us have is we have an overconsumption of chemicals, not of calories. So check this out. Inflammation is often misunderstood massively. It's by the way, many doctors and lay people turn to pharmaceuticals to reduce the symptoms of inflammation, when they really should be going after the root cause of why the inflammation is there in the first place, whether it's a problem with the cells, whether it's a problem with the microbiome, whether it's a problem with the genetics of the body. Like if you have certain genes that don't allow you to detoxify, which are called methylation gene issues like MTHFR, MTRR, VDR, COMT, those genes don't allow your body to pull the toxins out. So other factors, including the gut and gut health. In the Ohio State study, this is huge. Ohio State University shows that the vast majority of people that have pro-inflammatory diets, almost all of them have leaky gut syndrome, which basically allows food. So think about your intestinal tract like a tube, okay? When you eat food, the nutrients come down this intestinal tract in this tube. And in this tube, there are little holes in there that are supposed to allow the nutrients to get into the bloodstream through these little villi that grab the good stuff and pull it into the blood. That's our energy. That's our renewable resource of our body. That's your food turning into fuel. Well, a lot of that food is also waste. And when it mixes and churns with enzymes and other chemicals, and by the way, all the chemicals that are in the food that are not natural chemicals, like your PFAS chemicals, your heavy metals, your pesticides, your herbicides, your glyphosate, your gluten, when all those mix together, there's some nasty chemicals in there. And those chemicals, they can kill you, which is why if your appendix ruptures, you have to have it corrected immediately or you could die from sepsis. Well, when you have leaky gut, which is caused by increased stress, the standard American diet, having too many antibiotics in your system, a whole slew of things. Now that tube in your intestine, now it has holes in it, bigger holes and a lot more holes. And it's almost like a cheesecloth where now it's permeable. Now, not only do the toxins leak out, some of them will leak out into the bloodstream, some of them will leak out into the system and cause problems. But then what happens is the majority of the chemical toxins in your intestines will now get into your blood. Well, if those chemical toxins get into your blood, now you have a chance of getting septic. Now, there's different degrees of sepsis. Full on blown sepsis is you're in the hospital, you're dying from, toxins and inflammation in your blood. Microsepsis, which is what so many people who have chronic inflammatory conditions and leaky gut have, this inflammation and leaky gut toxins buildups over a long period of time, shuts down your organs and shuts down your cell function. The researchers emphasize the importance of anti-inflammatory foods, having a clean diet. They're saying eating more leafy greens, having more fatty fish, things like salmon and mackerel and healthy fish, eating things like garlic and oregano, having green tea in your diet, which is a very strong antioxidant that can offset some of the problems of having, these inflammatory foods, and minimizing inflammatory foods like processed foods, like dairy. So milk and cheeses are a big thing that can be very inflammatory. All processed lunch meats, fake butters, anything that's margarine, canola oil, or I can't believe it's not butter. I can't believe you would even consider eating it. Having synthetic salt, which is table salt, sodium chloride, get that out of your system. And anything that has red dyes, yellow dyes, glyphosates, or if you can't pronounce the label, you probably shouldn't eat what's inside the package. And that's a serious issue that most people have problems with. Now, let me give you a list of biohacks that you can do to help with the inflammatory issues in your body. Number one, eating an anti-inflammatory diet. How do you find out what that is really for you? The best way to do that is to eat for your DNA and to know your blood type. For example, if you're an O blood type, you need more protein and your body can handle red meat more than someone who has other blood types. Knowing those things are important. Knowing your DNA lifestyle of how your body processes fats, carbs, and proteins, ridiculously important, because then you can make the best dietary changes for you on that, for your proper lifestyle changes. So eating foods that are dense in dark leafy greens, fatty fish, things that are rich in omega-3 fish oils and omega-9 fish oils, eating things like berries. If you're going to have fruits, here's what I'll tell you. Me personally, I eat apples in moderation and I eat berries, primarily blueberries, raspberries, and strawberries. They have a lower glycemic index and a really good amount of fiber that offsets the sugar insulin spikes that keeps your gut bacteria and your inflammation down. Anything that spikes your sugar or spikes your insulin is going to spike your inflammation and spike your pain. So low glycemic index foods, nuts, berries, seeds, things of that nature. These foods reduce the inflammation of a pro-inflammatory diet. Number two, having omega-6 ratio that really is a 1-to-1 ratio. And you can do this on a blood test. You can measure your omega-6s and your omega-3s on a blood test. Most people that eat the standard American diet, most westernized food plans have too high omega-6s in it. Omega-666 is not good. You guys know what that number's, that's not a good number. 666 is no bueno. 3s and 9s are good. So how do we increase the 3s? Ghee butter, lots of good ghee butter. Omega-3 fish oils, phenomenal. 3 to 6 grams a day of those. You can take 3 to 6 grams a day of omega-3 fish oils, and it's as strong as most painkillers for most people. Having things like extra virgin olive oil, MCT oil, hemp oil, those are really powerful omega-3s that can really get your levels to come up. Chia seeds, flax seeds, fish oils, really, really beneficial. Most people, unfortunately, have a really high level of omega-6s. Usually it's about a 3-to-1 or higher. I've even seen some people that have had a 20 to 25 to 1 ratio of omega 6s to omega 3s. That's not okay. You're literally a walking, talking heart attack getting ready to happen. Here's another one: intermittent fasting. Intermittent fasting is one of those lifestyles that can reduce the insulin, reduce the sugar, and it can help your body maintain cellular integrity, which is going to help you big time when it comes to chronic inflammation. Like we talk about with fasting, fasting for a 16 to 18 hour window is minimum. Eating between a 4 to 6 hour window basically is skipping breakfast and having lunch and having dinner. Doing that for about 3 to 4 months, and then switching it and having breakfast and having lunch and not having dinner. I mean, changing up your routine is a powerful thing to do because your body will get used to the old routine. It'll get used to doing those things. And you have to keep the body constantly in a state of adaptation. If it's not going to continually adapt, it can't change for the better, and it will change for the worse. So intermittent fasting, very powerful, and it helps the body improve autophagy, which is the changing of cells, the improving of cells in your body. And if you do that, it'll really help you immensely. Another one is restoring your gut bacteria back to normal. We know that the vast majority of inflammatory reducing compounds comes from the GI tract. It comes from the bacteria that our body coexists with. Most people don't realize the power of the microbiome that we have. Even Hippocrates, the father of medicine, said, first fix the gut and everything else will fall into place. I will tell you that the reality of it is, if the gut bacteria is off, everything in the body is off. I mean, everything is off. Your neurotransmitter production is off, so your body can't think well and it can't feel well. The inflammatory markers are going to go high if you're not eating a spore-based probiotic, eating good healthy fibers, having those good healthy fats, which are the postbiotics. Having a spore-based master microbiotic is what I used, is a game changer for that. Eating fermented foods. Yes, yogurt is okay, but it needs to be organic Greek yogurt. It cannot be fortified with a bunch of sugars or sweeteners. If it does, it's going to cause the opposite effect. It can destroy the bacteria instead of helping the bacteria. So leaky gut's a really big deal. Here's another one that helps a lot: turmeric or curcumin. Curcumin as a supplement or turmeric as a supplement. Curcumin is an amazing spice. It has turmeric in it. Remember, if you're going to have turmeric, I'm a big fan of turmeric tea. I'm a big fan of turmeric as a supplement, but you have to have black pepper with it. Berberine is the name of it. If you don't have that with it, you can't absorb the turmeric like it's supposed to. So make sure that you have turmeric tea or turmeric supplement that has black pepper with it. And I really like 500 to 1,000 milligrams per day. It's a very powerful anti-inflammatory. Cooking with curcumin is really good as well. Just make sure you use the black pepper with that. It's that pepperine is powerful. Also, avoiding cooking with things like frying, grilling, or over seasoning foods with seasoning salts and sauces that don't have natural flavors in them, or don't have natural components in it. I remember growing up as a kid, my parents would always put seasoned salt on things. And seasoned salt, when you look at it, it's MSG. It's compounds that our body can't handle. So salt and pepper are good. Using organic herbs are really the key, but don't overcook. If you overcook, over grill, or over fry or air fry, that can denature the proteins and the fats in some of the foods. And that can lead to increased inflammation of that food you're eating. Hydration and electrolytes, super powerful. I want you to understand that being dehydrated can cause you to have chronic inflammation. And you could drink a gallon of water every day and still be dehydrated, because water by itself is typically not living. Unless that water has a squeeze of lemon or lime in it, unless it has a pinch of organic sea salt, unless it has something in it to make it living, unless it's infused with minerals or it's infused with hydrogen, that water by itself cannot absorb. H2O2 is not what our body was designed to drink. It's the minerals. It's the sodium, the phosphorus, it's the copper, it's all the compounds that are in that water, that natural spring water. So that's why I like drinking water that is filtered from fluoride and chlorine. Those are horrible things to have in water. And that has a hydrogen infusion into it. That's a very powerful tool. And it'll not only help hydrate, but it'll detoxify your body. If you're not drinking enough fluids, you can't push the toxins out of the liver, out of the skin, and out of the kidneys. We need to sweat, and the only way to properly sweat is to be hydrated. It's one of the best ways to get the inflammation out of the body. Having a diet that is high in polyphenols. Polyphenols are foods that are really high in anti-inflammatories and antioxidants. Green tea is probably one of the best polyphenols that you can get. Even eating dark chocolate, real cacao chocolate, dark chocolate has a tremendous amount. Extra virgin olive oil has a lot of polyphenols in it. So having some green tea on a daily, having some dark chocolate on a daily that doesn't have a lot of sugar in it, right? Good dark chocolate, 70% or higher is the chocolate you want. And extra virgin olive oil can really combat the free radicals and the oxidative stress from inflammation. Here's another one. Cold therapy. We talk about the benefits all the time. You know, when you're in cold water, when you're a cold shower, you cold plunge, you stick your face in cold water, or you even drink ice cold water occasionally. You know, we always recommend room temperature, but having ice cold beverages can cause a stimuli of what's called a shock protein, a cold shock protein. Well, that stimuli stimulates the adrenals, the hypothalamus, and the pituitary. And if you'll do that, that can change your body, and it can also push out and reduce some inflammation. So these are very good at reducing inflammation. It really helps improve these pro-inflammatory cytokines, which are chemicals that carry the inflammation away from the cells. That's what you want. That's why ice is always good when you have inflammation, swelling, and pain. When in doubt, ice for 15 to 20 minutes is always a smart thing to do. And then last but not least is magnesium. I cannot tell you how important taking magnesium when you have inflammation is. The average person is deficient in magnesium. I think it's latest data says that 75% of the global population is deficient in magnesium. And there's all kinds of magnesiums that are out there. So taking a magnesium glyphosate is the kind that I recommend. It's inexpensive. It's easy to absorb. If you get an upset stomach when you take magnesium, it's the wrong kind of magnesium for you. You need a chelated form of it. Get magnesium glyphosate. Magnesium glycinate is one that will help you get your serum magnesium levels up. Magnesium is needed in over 300 different enzymatic functions, including reducing inflammation. So how do you dose magnesium? Take your body weight times 10.6 and divide it by 2.5. That's how many milligrams a day of magnesium an individual should be taking in addition to what they're getting in their diet. And I'm telling you, with a standard American diet or even a Eastern diet, it's almost impossible to get the proper amounts of magnesium in your system. So look, inflammation is real. The foods we eat are causing it. The chronic pain that you have and chronic inflammatory conditions are going on in your system, and the chronic autoimmune issues you have could be coming from this inflammation. So take these steps that I just shared with you, put them into play, share this with your friends and family. This is just the tip of the iceberg of many, many things that you can do. I would encourage you to consult with a physician that deals with functional medicine and functional neurology. Help get to the root cause of your problems. Your knee pain, back pain, shoulder pain, chronic inflammation, or itis may simply be because of the food you're eating and the nutrients that you're not getting in your system. So folks, here's what I want you to do. Go back, re-listen to this, re-watch this podcast, share it with your friends and family. Start taking some massive action steps together today to create the future that you want and that you want for your friends, your family, and your loved ones. Go to our website. That's peptalk.world, peptalk.world. Go check out some of the amazing resources that we have for you, your friends, and your family to start following today, because that will absolutely help change your life. And make sure that you guys are liking, sharing, and tagging all this information on social media. The truth will set you free, but the reality of it is that the powers that be don't want the truth out. Why? Because keeping you fat, sick, and nearly dead is very profitable for them. It's not good for you, but it's good for them. So if you want to get off the merry-go-round, the hamster wheel, if you will, of sickness, symptoms, and disease, and live a life of happiness, health, wealth, and abundance, you have the opportunity. But the choice is all up to you. So folks, until we meet again, I'm Dr. Eric Naputi. God bless you. God bless America, and God bless the world. Stay smart out there, and I'll see you next time. Be well.